T-shirt was a giveaway.
Welcome back. We'll now resume consideration of estimates and supplementary estimates for the Ministry of Education. Ms. Beck, if you'd like to continue on.
Thank you, Mr. Chair. I'm going to try to tie up a number of questions that I've neglected to ask. With regard to the capital line, and the announcement of new builds, Minister, is the P3 model under consideration for those builds?
No.
And with regard to class size and the building of new schools, perhaps a small point, but in Moose Jaw, the new school is a consolidation of 4 schools. Would there be an expectation that class size would reduce in that situation, or would we be looking at an increase in class size in Moose Jaw?
I hope this answers your question, but the number of children in a class doesn't factor into, we don't think about how many children are going to typically be in a classroom in terms of the size. I mean, we know what the size of the school is, we know what the demographics are of a particular area, and the school is built to that demographic.
If it would be the same, if the 4 schools, the FTEs that are presently in those 4 schools would, the same number would transfer across to the new school, or would there be a reduction?
So we're going to build the school like we would, based on the demographics in the neighborhood, having some regard for any potential growth in that neighborhood. So we know generally what the demographics are with respect to the schools and the number of children that are in those four schools. Does that answer your question?
Sort of,
Kinda?
but
Kinda?
I think I'm going to move on. Minister, there have been a couple of projects that Minister Dennis has undertaken for the ministry, the most recent being the SCC, not sure the name of the project, but the reviewer where he was going around to SCCs in the province. I'm wondering if there's any indication of cost of that project that was undertaken and any deliverables that came out of that process.
I remember that conversation. So it was approximately $11,250 was spent. There was $8,000 on travel, for the parent and the support staff, $3,000 on locations, and there was a small amount, $250 for food and, well, $3,000 on locations and catering, so that would be the locations and whatever snacks and stuff were provided at those, and $250 for translating the final document. There were a number of key themes. I can certainly provide those to you, but the key themes involve the effectiveness of school community councils and the conseil, roles and responsibilities, parent engagement, communication, and understanding community and providing advice. So there was a number of key themes that came out of those consultations that we did with parent community councils.
Are you intending any actions based on the key findings of that report?
Saskatchewan School Boards Association continues to work on the role of parent councils, school community councils, and so this information has been taken as a result of the initiative that you referenced, as well as the ongoing work that the Saskatchewan School Boards Association is doing, continues to come together to redefine or reinforce what the engagement level of engagement opportunities of our school community councils can be. There was a recent thesis done by the Saskatchewan School Board's Dr. Ted Ament, who reviewed and looked at that one. And so that, as well as creating an awareness, I believe, is the roles and the function of the school community councils. These two align and correlate to one another.
Okay. Thank you. Is there any support in this budget for any of those initiatives, or any initiatives related to that work?
As you know, there is some funding in the budget for the support of community councils. But as far as the work that's going to be done or anything that comes out of the work that was done by Mr. Dennis, any of those costs will be just absorbed by the ministry.
Thank you. Minister, it's been a few years now since the parents' report and the subsequent new funding model. I believe when that report came out, it was described that there were still some areas that might need amendment or further work in terms of the funding model. And one of the areas that I hear concerns about is support for students with intensive needs and that SFL piece. Can you describe work that's being done around inclusive education in the province?
With regards to the ongoing, I'll call it the ongoing review of the funding model, there is a operating grant advisory committee that has representation from our education sector partners, which includes the STF, LEADS, SASBO, obviously the ministry, and SSBA, that come together to review specifics that are surfaced and questioned as well, and so they take some time to look at that, and that's an ongoing. So supports for learning, to get back to your question, supports for learning is one that is reviewed by this committee to see if in fact the funding formula is still relevant, applicable, and supportive of the supports for learning within our province.
Changes anticipated? One of the concerns that I hear is that, you know, the assumption of a uniform level of need across the province doesn't match the reality of how those needs are, you know, higher or lower in some school divisions as opposed to others.
It's one of the ongoing conversations to see, again, review of the data, the information, and the resources, and see how it continues to support, and if there are ongoing considerations for change, they will be brought to this committee and then surfaced from there.
A few questions, sort of, they seem not connected to each other, but I'm just cognizant of the time here. One question I do have and has been raised as the possibility of ASL as a language of instruction. Is there consideration for that?
Susan Edelkov-Anderson, Assistant Deputy Minister. In terms of American Sign Language, there have been some conversations about the creation of a provincial course in American Sign Language, both at the Ministry and also with the Curriculum Advisory Committee. Currently, there is already a locally developed American Sign Language course that's available to school divisions should they choose to use it. But as I mentioned, there are conversations about moving that to provincial status. Some reasons for the conversation would be, of course, to support students who do need to use American Sign Language as their form of communication, deaf and hard of hearing, students who are nonverbal. Also, it's another language for any student to use, which is always a good thing when you can learn an additional language. It's a chance to learn about deaf culture, which you know, is also widening the understandings of students in the province. And you know, if students are watching the Premier during his daily briefings, they're able to see an interpreter standing next to the Premier, and you know, so it might be an opportunity for students to think about a career as an interpreter as well.
Glad to hear that's under consideration.
Further on that, we've certainly had many overtures from members in that community about how important it is to advance this. So I think I can say that we're certainly prepared to advance it as quickly as we can. But there is work being done, and so we're pretty pleased with where we're going to be going with this.
Hear that. Would that be something that would commence at the kindergarten level, or is there the exploration of supports for students, or for not students, I suppose, but children in earlier years for that ability to start learning language earlier in life?
So right now the conversations are around the secondary level.
Thank you. With regard to dyslexia, I've been recently made aware that there has been a letter that has been presented to the Human Rights Commission in Saskatchewan following a decision out of British Columbia and following the Ontario Human Rights Commission, their review of, or their inquiry into right to read. I'm just wondering, some of the concerns that have been expressed to me are around the appropriateness or the efficacy of students who are diagnosed with dyslexia, particularly around whole language or leveled reading, in terms of its appropriateness for those students. I'm just wondering if there have been any discussions about that.
You had asked a question whether or not I was aware of any, complaints or any things that had been presented to the Human Rights Commission, and I said at the time that I wasn't, and I'm still not, so I'm not aware that there's been a complaint made to the Commission, but I'm certainly prepared, and we have very regular conversations with the Chief Commissioner of the Human Rights Commission, and I'm certainly willing to open up a conversation with him about this if it's an issue which he is inclined to explore. I'm not. I'll ask Deputy Minister Curry to comment on the issue generally, but to the extent that there's been a concern raised with the Human Rights Commission, I'm certainly prepared to explore that with him. As a matter of fact, I think I have a meeting with him early next week.
I agree with what the minister is saying here in terms of the ongoing conversations with the human rights, and to ensure that we utilize and provide for our students, any one of our students in the province, through our resources, through our supports for learning resources, to provide an education opportunity for them as well.
Okay. Yeah, it's been raised a number of times by parents, and of course, these parents come. I don't have that background, but it's been a concern that has been raised a number of times. On the theme of reports, just occurred to me to ask, a number of times we've talked about curriculum renewal in the province, and often the work of Member Lambert is noted. I'm wondering, is there a document that came out of her work when she went around the province talking about curriculum renewal? I've not been able to get my hands on that document.
So there was no formal report that was done. There was just the establishment of some principles and guidelines with respect to how curriculum development would move forward, and on the basis of that work, the freeze that was imposed on further curriculum development was lifted, and that's what gave the impetus to the now ongoing work that's being done by the ministry through the Curriculum Advisory Committee.
Are those guidelines and principles available?
We're happy to talk about them, or we can provide them to you.
Great, thank you. Something that I wanted to ask about, Minister, I've been approached at 2 different times in my role as a critic from two young people here in Regina. Both have taken to online petitions, both requesting similar actions. One is Toby Amoefa, who has collected more than 28,000 signatures, and Altoya Reid with over 700 signatures on a petition that has been recently launched. Both of those referring in part to anti-racism or anti-oppressive curriculum or training in schools. given, I suppose, recent events, but, you know, events that have their roots further back. I'm just wondering if there's been any consideration to broadening or increasing the anti-racism curriculum or supports that are available to schools.
Well, the quick answer to that is yes. I've spoken to Toby. We had a conversation on the telephone earlier this week and encouraged him to continue his work. And I've also asked the ministry to reach out to him because he's certainly indicated a desire to help participate in the development, potential development of new curriculum around Black history, which is the part of his petition. The issue with so we're certainly anxious to have him participate in any further development. I indicated I was pleased to put his name forward to the ministry. So he's taken quite an initiative with respect to preparing that petition, and I can't remember how many names he had on the time that we had talked, but there was more than in the email he had sent me a couple of days earlier. So we have had that, we've reached out and had that personal conversation. It was a very interesting conversation. So that's where we're at with that particular petition. I can tell you that the work that's being done by the ministry, between the Ministry of Education and the Ministry of Justice, in conjunction with the Chief Commissioner of the Human Rights Commission, to advance the issues of racism within schools, to talk about, you know, not just rights, but talk about responsibilities, some of the consensus work that's being done through the Human Rights Commission. We continue to have those conversations, continue to encourage the Human Rights Commission to participate in that, and the school division around the province have been very receptive to the work that's been done, because we think that that's a key in terms of reducing reducing racism. Certainly education is a key to that. I think we all agree to that. Part of the work, and you know, I very much like to talk about this, the province's commitment to treaty education in the classroom. We renewed that work last year. The ministry is doing some work now with respect to Métis and Inuit work, so that we can incorporate that into that very good work that the ministry has done. And so this is very top of mind for us now, and I think you've heard the Premier make some comments about where the province stands on racism and how we need to continue to do and be more vigilant with respect to it. And the education system, I think, is a key to getting that done. So we're very pleased with the work that's being done in conjunction with the Human Rights Commission and the work that's being done in the classroom.
Thank you, Minister. I'm pleased to hear that. My next question was around specifically the recommendations that were contained in both the TRC report, but also most recently the Missing and Murdered Indigenous Women's report, both of which do note a significant role that our K-12 system can and should play in reducing racism and you know, reducing negative outcomes, I guess, to put it one way for Indigenous people in the province. So I'm pleased to hear that work is underway, and you know, look forward to hearing reports about those initiatives. Along with bit of a theme in terms of reports of provincial secretaries. Member Dennis was also tasked with library review in recent years. Well, that report, and I have seen that report, it seems that there hasn't, at least publicly, been a lot of changes or initiatives that have come out of that report. I'm just wondering if you could provide an update about the work of that report and any work towards changes within the library system. I believe what was promised in 2017 was after the proposal to cut half the funding for the provincial library system, and the reversal of that decision, there was a promise to undertake a review about modernizing libraries and funding and the role of libraries in modern Saskatchewan. So I'm just wondering if you could provide an update there.
The work, it's kind of a timely question because I met with representatives of the Provincial Library Association this morning by telephone, of course. They're still working on their sector plan. There was to have been a meeting in late February, which canceled. So I asked that question this morning on the phone, and they said they're going to now continue or at least restart the work on their sector plan. But certainly in understanding the importance and the role of libraries in our communities is certainly a focus of what they want to do and making sure that they have the supports necessary to provide those services. So we await the finalization of their sector plan, and from there we'll be able to make some decisions in terms of further support.
Can you provide a little bit of information about the scope of the work of that sector plan? Does that involve the funding model or?
So a number of things that they're considering as part of the development of their sector plan. There was a number of themes that came out of the work that Member Dennis had done, but some of the work that's being done with respect to the sector plan, talk about funding structure and predictability, part of the Provincial Public Library Strategic Plan, the communication with provincial library governance, indigenization, value, and legislation. So there's a number of things that they're going to be addressing in their sector plan. So it's going to be a kind of holistic plan addressing a number of different areas of concern to the sector.
When is that sector plan expected to be finalized?
What did you say? It should be by the end of the year. As I've said, it's kind of delayed with recent events. So.
Okay, and including, I heard you say an update at potentially the funding model. When was the last time the funding model for libraries was substantially updated?
We're not quite sure when the funding model was last reviewed, but we'll endeavor to get that information from the provincial librarian.
It's one of the concerns that has been brought up, and some of the assumptions made in the funding model don't meet the reality of how libraries are function today, or could function.
Yeah, one of the themes that we talked about today. So.
I note that the increase in funding for libraries is less than $100,000. What percentage increases does that represent? I could probably pull out my calculator, but maybe, pardon me? 1%, okay. That's, that doesn't meet CPI. That doesn't, are there concerns that have been expressed within the sector about the impact of that budget? With regard to layoffs or reduction in services?
That wasn't the topic that came up in conversation, but certainly as part of the strategic plan, that will be, you know, in terms of the funding sufficiency, that will that's part of the review with respect to the strategic plan. So any consideration of further increases to the library sector, I think, are going to have to be based on the strategic plan. So in order to ensure that we're properly supporting them, I think what we need to do is wait for that strategic plan to be completed.
I note also under the subsection E, subvote ED15, the amount for literacy in this budget is flat year over year. Can you remind us some of the programs and initiatives that budget line supports, and why we're seeing no growth in that budget line this year?
Just, as it is referenced, the amount or purpose of the literacy budget does not change. There is no reason to maintain separate literacy and literacy subvotes. The 2021 provincial library and literacy budget of $14.4 million now combines both the literacy and the family literacy budgets. What does it support? It supports the family literacy hubs as well as the literacy camps. They are presently under review, that we have an ongoing to see are they meeting the intended targets to which they've been established. So we continue to see that the family literacy hubs as well as the literacy camps do in fact meet the intended targets to which they were established.
I guess, thank you. Given the concerns about, you know, the summer slide, and now we have a sort of that times 2.5. Has there been consideration about putting additional supports into some of those community-based literacy programs over the summer to help augment student learning or get them ready for school in the fall?
Thank you. There is consideration given, yes. Part of this review is to look at a number of these literacy camps were established a number of years ago, and they do good work. What we're looking at is we see that there are needs elsewhere. And so the review is looking at the existing literacy camps that are taking place, the impact that they're having, while keeping an eye on the needs that are surfacing or may be surfacing elsewhere in the province. So with our responsibility of doing assessments of ongoing assessments, facilitating those, we look to see, okay, is it meeting the impact as was aspired in the beginning? And if so, we look for the resources to be continued or established there. But we also see that there are needs elsewhere in the province, and so with our resource allocations, look to see where their needs are greatest and where there are other needs that can be addressed given the literacy components of which you're speaking. We also see that there are a number of partnerships that have been realized here over the last number of years, significantly like the Regina United Way and Saskatoon United Way, where we do have literacy camps that are combined in terms of support through the Ministry of Education as well through the United Way, the United Ways as well, that have been significant and instrumental in helping students, as you referenced, prevent or if at the very least minimize the summer slide. And I do believe that there was one that was just started in Moose Jaw too here this last summer that was a kind of an enhancement of the literacy camps that have had significant impact in Regina and Saskatoon.
So the literacy camps are conducted exclusively in Regina and Saskatoon, is that correct?
No, those are part of the
Program.
correct,
Okay,
yes.
so with regard to the literacy camps, where are those offered?
There is a family literacy camp that's put on through the Creighton School Division, one through the Ela Lacrosse School Division, Light of Christ Roman Catholic School Division, Living Sky School Division, Northern Lights. That's 12 literacy camps. Prairie Valley has 2 literacy camps. Prince Albert Roman Catholic Division has 1 literacy camp. There's 1 literacy camp that's put on through Saskatchewan Rivers. There's
the Northern Library System.
There's 1 through the Northern Library System for books and resources. There's also summer literacy camp model that's put on through Frontier College.
And do those funds flow through this summer? Like the money introduced in this budget will go to those literacy camps for this year? Okay.
That's right.
Okay, thank you. Kids First. Moving on to subvote 8. Kids First, I note there is a small increase here to their funding. How many families or how many children are accessing Kids First programming this year and most recent years? Also curious about how many families were screened, whether there's a wait list, how many you were able to provide services to of those families that screened positive.
Targeted program, the Kids First targeted program serves approximately 1,700 vulnerable families annually, resulting in almost 74,000 services that are provided. The regional Kids First program in 1920 served just over 15,000 children and 13,000 adults for a total of 28,464 individuals, and that was hosted in 266 communities.
Are there wait lists for any of those programs? You noted 1,700 families or children?
Families.
Families, okay. And when you say 7,400 services provided, I'm not sure.
74,000 services. Just give me a half a sec.
No. Sorry, there are no wait lists.
There's no wait list.
Okay.
Some of those would be home visits, mental health services, connections to community programs, those kinds of things. So those would be the connections, the services.
Okay. No wait list. How many families were screened? We're still doing universal screening.
Do we know how many were screened?
Kids first.
It's a referral program, so there's no formal screening that gets done, and I understand there's capacity in the program to take on more families.
Okay. So there's no hospital screening. The early childhood intervention program, again, a modest increase there. That basically I would describe as flat. How many families are involved with ESIP currently? How many children are receiving services?
But there was an increase in funding in this budget for ESIP. The number of children. In the last fiscal year, they served 1,354 children in the provincial program.
For ESIP?
Currently, there's currently 9 ESIP locations that have wait lists totaling 273 families. That's a reduction of 20% over the earlier quarter.
When you're looking at, I understand from previous questions that there is an intention to revisit the early years strategy. Will these programs and how they interface, will those be under review within that process?
Again, we've received some federal dollars that have assisted in these opportunities and these supports here. So part of the ongoing, I would call it, when I call it a review, it's part of the ongoing observations of effectiveness. Is it meeting the intended target? Is it meeting the intention of assist and preparation for the one's future? So this, as well as others, continue to be looked upon as to, are they meeting the intended targets in terms of supports and enabling people to be prepared for their future. So this, as with the others you've referenced, would be part of that ongoing when I call it a review, I'm also meaning kind of an assessment. Is it in fact meeting the needs of our community, of our children? And then we would make plans from there.
In terms of community need, and part of the reason I draw attention to the relatively, I recognize there are small increases, but relatively flat with, respect to inflation and such. I don't see the need in the community being reduced. I know we have high rates of child poverty in this province, for example, and those children needing supports. We also see high numbers of children entering kindergarten without the skills that they need to be successful. And so I guess I'm just a little surprised that while the need seems to be increasing, those numbers have remained relatively flat. And that's why I'm asking about, when we look at a new early years plan, if we're looking at, those investments and, basing that on the need that's in the community.
One of the things that we've noticed that the ESIP increase has been a 2.5% increase, but we've also noticed that on average, the 27% of the children who enter the ESIP with extreme delays, after intervention, we found that number shrinks to 7%. So we found that the involvement and the supports that are realized through this initiative are in fact impactful, and we continue to see growth and development. So what we're seeing is continuing, as you asked before, in our ongoing review of what is an impactful intervention initiative opportunity, and this is one of those that we see providing that opportunity.
I've no doubt of the impact and the importance. I guess that's the concern when I see a wait list that those families don't have access to that impactful programming.
As you know, this is all flow-through money from the federal government that supports this particular program, but it underscores, I think, the conversations that I've had with Minister Hussein about the importance of not only supporting childcare, but supporting early intervention and programs like this. So I've been encouraged with the conversations that we've had with the federal government about increasing support through this program, and we'll continue to push that. It's certainly one of the platform considerations of the federal government. So we'll continue to work with the federal government to see what we can do about enhancing federal support.
So the flow through from the federal government to ESIP and Kids First, do you want to give a breakdown, provincial versus federal dollars on that?
For the record, the federal funding on ESIP is to deal with children on reserve, right? So that's their funding, the rest of it's provincial funding. So we will continue to have those conversations with the federal government with respect to increasing their contribution, because we know that there's some significant need for those children who are on reserve to access this program.
So, thank you, Minister. So with regard to this number that we see here, 4,394,000, how much of that is federal money? Or this is all provincial?
It's all provincial money.
Minister, during the pandemic, we noted, I think everyone realized the importance of connectivity. A lot of people were working from home, a lot of children learning from home. One of the things that allowed many students to access technology was the removal of the data cap from that SaskTel allowed. I'm just wondering if when we're moving into the fall, and should it, hopefully it doesn't, but happen that there is another outbreak, have conversations happened with SaskTel to provide that support to families in order to allow children to access online?
There hasn't been any discussions with SaskTel with respect to that, but that certainly doesn't mean that there wouldn't be some conversations with SaskTel should that be necessary, because we quite appreciated the fact that they eliminated the cap, and it did provide some opportunities for the online learning to the extent that it was provided. So that would have to be a conversation we would have with SaskTel at the time.
And with regard to the cost to divisions providing technical support, be it, I know some school divisions provided I'm going to show my ignorance of the the actual technology, but like a flash drive ability to access internet for some devices, or handheld devices or tablets, or IT. Do you have an indication of the increased cost that school divisions incurred in order to ensure that students had some access to technology, and did the ministry provide any support for that technology?
We don't have any particulars in terms of what those additional costs will be. It's certainly something that I think is part of the kind of the debrief, so to speak, as we go through this. So we'll try to understand those numbers, but we don't have anything to present to you today.
With regard to, I remember in the 2017 budget, there was a note of an allocation increase for CommunityNet and live network services. I'm just wondering if there's any allocation to CommunityNet or any changes that are anticipated in this budget.
So the budget this year doesn't show an increase for the allocation for CommunityNet. The previous contract we had with SaskTel has expired, and we're currently negotiating a new contract. As with lots of technology, the prices are dropping with respect to the kind of services that are available, and so what we anticipate over the next few years, once the new contract is negotiated, is that for the same amount of money, we'll be able to get an increased service, some different kinds of services, as well as increased bandwidths for schools.
And that contract is currently open, or,
Yeah, we're currently in the process of negotiating that.
okay. And anticipation, completion date of that contract, do you have?
Summer,
Summer. Summer or fall? Okay.
probably summer.
Okay, thank you. Certainly, yes, we've all tested the bandwidth in the province over recent months. Okay, thank you. One question I had with regard to capital, I'm waiting to get the cane here. So, one of the capital announcements, I believe, was for Notre Dame College. Is that correct? Did I make that up, or was there? Yeah. Okay.
Yeah, Alpha Murray, yeah.
Okay. Yeah, I guess we always called it Notre Dame. Yeah. With apologies to the French. Is that, that's the first time that, since I've been critic, which has not been forever, but there has been capital allocation for private schools. Is that a new thing, or is this something that's happened before?
We have, there's been a bit of a history, but I mean, we have provided money to Luther for the gym a few years ago. The government in this particular budget is going to be providing 20% of the share of the renovation and the addition that they require out there.
Total amount? Sorry, I think you announced it in the budget.
So it's $4 million, which is the government commitment to the addition.
Okay. So the process for requesting funds for schools outside of the 27 school divisions, what's the process for those schools to access capital funds?
They just make application and they're eligible for up to 20% of the capital cost.
Is that just historical high schools, or is that,
So,
okay, in regulations, okay, just for historical high schools, or that?
just historical high schools.
Thank you for clarifying. Minister, do you have an indication of how many students took advantage of the SaskTel program, the lift on the data cap, during the, I guess, March to June period?
We don't have that information, and I'm not sure whether we can get that information from the school divisions or not, and I'm not sure if we can get the information from SaskTel either. I mean, we'll make the inquiries, but we don't have that. We're not sure.
I guess maybe school divisions would have access to the number of students who requested paper packages or something like that, who weren't able to access technology.
Well, I would guess that they would have that information. I'm not sure if they've compiled that information from their individual teachers or individual schools or classrooms, but I would think if anybody has it, they would have it. We don't, but I'm not sure that they've compiled that information.
Oh, now I'm really getting close to the clock. But one of the things that was mentioned in the guidelines, and I just wanted to quickly canvass in terms of the plan. I think we've all agree in the mental health concerns that have arisen in recent times. Just looking for an indication of supports that will be available either now or through the school year for students and staff that are experiencing increased mental stress.
The ministry provides grants for school divisions, so school divisions can apply to the ministry for grants to support mental health and student safety training.
Having reached our agreed-upon time for consideration of the items of business, the committee will now adjourn consideration of the estimates and supplementary estimates for the Ministry of Education. Thank you, Mr. Minister, and your officials. Are there any closing remarks?
Mr. Chair, except I would certainly like to thank you and the committee for their patience tonight, and all the officials, Deputy Minister Curry and his officials for their time and support. Certainly I'm very fortunate to have the leadership team that I have at the Ministry of Education, so I want to thank them. Thank Ms. Beck for her respectful questions tonight and Hansard. And with that, those are my comments.
Any closing remarks?
Thank you, Mr. Chair. Again, I'm probably echoing many of the minister's comments, but thank you to yourself and the staff at the table and Hansard, as well as the other committee members. Minister, to yourself, Deputy Minister Curry, thank you. It's always a pleasure, and thank you to all the officials that we've had over the last 2 nights. I don't want to think about all the sunshine we missed, but sincerely want to thank each of you for, I know what has been a big burden and an extraordinary time, a very important file that you all preside over. And, you know, the Minister, the questions that I ask are hopefully in service of, you know, helping allay some of those fears that are out there and helping, you know, find the way forward to ensure that we get kids back in the classrooms and in daycare centers and libraries open in a fashion that serves all of the people of this province. And I appreciate, hopefully we've gone some measure towards that over the last 7 hours. Thank you.
Okay, thank you, Ms. Beck and Minister, and we'll now have a brief recess for sanitizing. Thank you. Welcome back, everyone. We will now consider Bill 199, the Opioid Damages and Healthcare Costs Recovery Act. Minister Ryder is here with officials. Minister, please introduce your officials and make some opening comments.
Thank you, Mr. Chair. I'm here with Rural and Remote Health Minister Warren Kading, with the Deputy Minister of Health, Max Hendricks, and counsel from the Ministry of Justice, Max Bilson and Kyle McCreary. We're here today to discuss Bill 199, the Opioid Damages and Healthcare Costs Recovery Act 2019, and amendments to the Health Administration Act 2019. I believe we're all familiar with the issue at hand, as I spoke to this at the second reading back in November and as the bill was moved to this committee a few days ago. There's a real need to take action to support and strengthen the class action lawsuit against opioid manufacturers and distributors. This legislation will allow Saskatchewan to participate in the proposed British Columbia opioid class action. This is similar to legislation already passed into law in Alberta, Ontario, Newfoundland and Labrador, and Nova Scotia. So we're not alone in this action. As we're talking about a matter that is before the courts, I'd just like to remind you that there may be questions that we won't be able to answer, as we can't compromise our position in those actions in any way. I thank the committee for the time here tonight, and Mr. Chair, our officials and I would be pleased to take questions.
Okay, we'll open it up for questions. Ms. MLA Mowat, please.
Thanks so much, and thanks to the officials for joining us this evening as well. I wonder if we can start off with why you think this bill is necessary to strengthen our position in the class action.
I'll just make a brief comment, and then I'll ask one of council to add to that. That would be mostly a legal issue, so my understanding is, as I mentioned in the opening comments and in the speech last fall, that I think it's important that we join British Columbia and the other provinces in this action for reasons I got into at the time. But as the question is more of a legal nature, I would ask whichever of the council would be prepared to delve into the legalities of the need for the legislation.
Thank you. My name is Max Bilson, and I am a Senior Crown Counsel with the Saskatchewan Ministry of Justice. And thank you for the question to the member. And if I understand the question correctly, you were asking why the bill is necessary to support the class action. I think in essence, the bill is important for a number of reasons. The first of which I'd highlight is just that it does allow us to bring a direct action against opioid manufacturers and wholesalers in the same way that BC is. And that allows us to indicate, to assure a BC court or any other court in Canada that we, as a province, have taken the determination that we support this type of litigation, and that's an important signal to send to a court. There are a couple of other matters that I think are also why the legislation is necessary, the first of which would be it allows us to use statistical and epidemiological evidence on a population-wide basis, and that allows us to make a claim on an aggregated basis, and it changes the limitation periods, and that is also important when you're considering an action of any kind, including the BC class action.
Thank you. Can you clarify what you mean about changing the limitation periods?
Sure, thank you. The basic limitation period, as I'm sure you're aware, is 2 years from the discovery of a claim. But Section 7 of the bill changes that limitation period to 2 years from the bill coming into force, so that shifts the limitation period potentially quite dramatically.
Thank you. In terms of, you know, if we're getting into the damages that have been caused, what is our estimation of what the opioid crisis has affected us in terms of damages?
I'm afraid I'm unable to answer that question. That's an important question, no doubt, but that gets into litigation strategy and into matters of evidence that we're unable to speak to tonight.
I was suspecting that might be your answer, but I did think that, you know, it's something that we obviously need to be determining before we are going forward. I think in terms of if we're seeking to recover from opioid manufacturers, it would be useful to define the scope of the problem. So in terms of incidence rates with opioids in Saskatchewan, actually I wonder if Ms. Chartier wants to ask some questions about incidence rates.
For sure. Okay, obviously, well, first, I think it's important to recognize that opioids have impacted people here in Saskatchewan and impact individuals and impact our healthcare system. So this suit and this bill are really important. But to be able to quantify that, I know that I've asked written questions about opioid use in the past, particularly around residential treatment. I know we track crystal meth, but I was told in a written question that we don't track opioid reporting. People who present into residential treatment facilities, it says this data is not available. So just trying to get a sense of what data do we use to track opioid use or misuse here in Saskatchewan?
So we do track the deaths related to opioids. So these would be obviously people that have showed up at our emergency rooms. We probably, and I just don't have it with me, but I can probably get it, the number of people that show up in our emergency rooms with an opioid related overdose. So I have the deaths, and so for 2017 there were 89. In 2018 there were 128, and for 2019 there were 112.
Okay, do you go back any further than 17?
I can go back to 2010.
Oh, you know what? Let's do that.
Okay, so 2010 there were 51. 67 in 2011, 62 in 2012, 69 in 2013, 69 in 2014. In 2015 there were 94. In 2016 there were 83, and then 2017 was the 89.
And we, in terms of population, I'm just thinking about the auditor's report in 29. So those are opioid poisonings, or are we also, so you track, I just want to get a clarity around measures that you use. So you track opioid related deaths. Can you tell me what other measures? I know you track opioid poisonings in hospital, but instead of me trying to guess or put them on the record, would you just mind giving us a list of all those things that you track around opioid use?
You'll have to give me a minute.
Yeah,
to find that.
You bet.
Okay. What we have is the 2019 rate per 100,000, which would be provided to us through CIHI, and Saskatchewan's rate was 22.9 per 100,000. That's opioid-related poisoning.
And Saskatchewan was pretty high compared to, I mean, cities like Vancouver and Toronto, I believe, had, compared to Saskatoon and Regina, if I'm just casting back to that auditor's report, that our rate was per 100,000 higher than those two cities. Is that correct?
Provincially, and so we were a little bit higher than BC. BC was 22.4 per 100,000, and the Canada-wide was 15.2 per 100,000.
Yeah, the auditor had it listed city-wise, so she would she not have gotten that data from the SHA or the ministry?
I'll have to check to see
Okay.
if we have that, yeah.
Back to the question, so what measures are you using to track opioid use? So we know that you track opioid deaths, and we know you track opioid poisonings or in hospital, and you track people who leave the emergency department. I'm wondering, and then we'll ask for numbers here too, but I'm just trying to see if there's any other numbers that you use to track opioid misuse.
So the other thing that we do track is the utilization of take-home naloxone kits. And so between November 2015 and May 2020, there were 5,900 take-home naloxone kits distributed through the program. And over 8,400 individuals have completed the training to administer naloxone. As of May 1st, 2020, we have been informed that 800 or 980 of those cases or kits have been used. The other thing that we do track is the number of EMS responses to suspected opioid-related overdoses, and we have those quarterly for 2019, and there were from January to March 68, April to June 78, July to September 97, and from October to December 78.
Province.
Yes.
Okay. In terms of, okay, so you've given us the number of opioid deaths, and then you've given us the rate in 2019 per 100,000, but could you go back? I'm just trying to get, like, so you had the deaths to 2010, so I'm just trying to get a consistent picture of all these different measures. So opioid poisonings going back to 2010.
I don't have that information with us tonight.
Would it be possible to get that tabled in the, I won't ask for the week like I did the other day.
I think we could probably put that together, yeah.
Okay, in the,
Yeah, so like you had mentioned the auditor's report, and at the request of the auditor, we did a run of information. So I assume that we can generate that information as well for opioid poisonings.
back to 2010, just so we stick with the same. And you also track the people who leave the emergency department, because I have had a written question here, and you had provided that information as a percentage of people who leave without being seen, percentage of emergency department visits in Saskatoon and Regina hospitals with problematic opioid use. You took us back to 2013-14. If you, and you've provided us 1920 Q1. Would it be possible to just get those 2010, 11, and 12 years for that? And then the EMS numbers, you gave us 2019, I think, just now. How far back have you started? Is that a new stat that you've been tracking, or have you been tracking that for some time?
For a few years, for sure.
Could you take us back to 2010?
I don't know if we can go that far back.
Yeah.
So.
For however long you've been tracking that,
Yeah.
then. And why is it that you track crystal meth people who report to residential treatment facilities using crystal meth, but you don't seem to do that for opioids?
Can I have a minute?
Yeah.
So methamphetamine, people that enter those settings, the coding in our data is very clear because methamphetamine is a unique drug. And it is less clear for opioids. It's a class of drugs with a wide range, and apparently just due to the nature of the database, it is something that we don't extract. Just it's complicated and considered to be unreliable because there are a variety of opioids.
I'm just going back to thank you for that. Just going back to neither Vicky nor I were able to jot down the naloxone time frame that you gave us. You said there were 5,900 kits distributed, and we didn't catch the dates there. I think 2015 to 2019.
To May 1st, 2020, there were 5,900 kits distributed to 8,400 individuals. And as of May 1st, 2020, so since we started tracking, 980 of the kits were used to reverse an overdose.
How do you, forgive my ignorance here, but how do you know that there not only 980 were used?
You raise a good point. You don't necessarily absolutely know if it's not reported to EMS or to somebody afterwards, which when there's illegal drug use is a possibility, I think.
980 really is just those reported to EMS.
That's the only way we would know.
Well, I was curious too in my written questions. I had asked, I think in the fall, that for all SHA-funded detox sites, how many naloxone kits were given out each month since the program began. And since January 2019, there had been 62 naloxone kits distributed over that from January 2019 until I think it was the fall when these questions were asked. But the numbers in detox, well, social detox, are over 4,000, and I'm just trying to find, there literally are thousands of people in Saskatchewan who go through brief and social detox. So I'm just curious in why in that time frame is it not policy that if you're leaving brief or social detox, or wouldn't it be a good idea to make sure that people who are using illicit drugs are provided with a tool that can save their lives?
But like you're saying,
everybody who shows up at a brief or social detox has an opioid use issue, but I'm sure more than 62 of those people did. So what I'm wondering is around policy in brief and social detox. What is the policy around naloxone distribution?
yeah. So, you know, when we talk about rapid and social detox, a certain percentage are there for crystal meth, right? A certain percentage are there for opioids, and I would say a range of opioid type of abuses, from heroin to, you know, fentanyl, whatever. And what I'm told is, yes, generally a person who is abusing an opioid and identifies with that would generally be asked. Oftentimes they already have a kit, and so we don't reissue them another one if they have one. And so, but generally that would be considered good practice. Is it 100% across the board? I would hope so, but I don't know for certain because we don't track it. It's good clinical practice though.
But you do track the percentage who do show up with opioid use in our brief and social detox.
That was the number I said that I couldn't provide to you for sure. Yeah.
Okay. In terms of, I know you'd said you could table the opioid hospitalizations, and we talked about the province-wide number, but you'd said you had done a run for the auditor on Regina and Saskatoon. So I'm wondering if it's possible to get Regina and Saskatoon, and it would be interesting to see in terms of impact, where the largest impact is. Would it be possible to do Prince Albert and Estevan, like sort of getting a little further north and a little further south? Or any of the other cities?
Yeah, in terms of locality and what we can identify, you know, I think we told you in committee last time that, you know, again, still not on the residential part of it, but in the hospital thing, we would have information through CIHI, I suspect that we could run. Yes.
Don't you provide the information to CIHI?
But we actually, it goes through a distillation process in CIHI and a categorization, and so it's as a deputy, I'll be honest, it's one of the frustrating things, the time delay until we kind of get the data back in a form that's usable and reliable.
Fair enough. In terms of time frame, so obviously we're talking about the short term here, what to do until we hopefully get settlement. Do we have a sense, I know court proceedings are long and drawn out. Do we have a sense of what that might look like?
I share your opinion on how long things can take in the courts, and I was just talking to legal counsel, and they said there's just so many variables and so many things that could happen. It's virtually impossible to put a timeline on it.
Well, and I think that's why we're asking some of these questions, because we know it's the problem is pressing and urgent today, and getting money from the pharmaceutical companies would be beneficial, but we need to address the problem now for sure. Vicki, do you want to ask a few questions?
Sure. We asked about what measures are being tracked or what ways that opioids are being tracked. Do you know if other ministries are also tracking in different ways? I'm thinking of justice, just in terms of getting a full scope of the picture.
sorry, we assume that they do have data in corrections about, inmates that are incarcerated with opioid addiction, but we don't have that with us. One of the things I just maybe thought I would talk about and repeat from, I guess, our earlier estimates is in January I met with the chiefs of police, as I told you, from the two largest cities and the head of the RCMP, and we're kind of, reestablishing. We have had a drug task force, but we're adding, I guess, some resources to that. We've established new terms of reference. We're going to make it a higher level committee that's chaired by myself or an ADM, and also involving the chiefs of police, so that kind of gets the attention that it deserves. One of the things that we talked about when we met with the chiefs in January was getting reliable and consistent reporting on kind of key measures related to opioid and crystal meth use in the province, and actually making those available so people have a good idea about the differences across the province and where there were escalations in the use of these drugs. And so some of it will obviously take different ways of looking at our data and pulling our data on a consistent basis. Some of it might require enhancing our existing databases, but it's something just with the escalation in recent years that we feel that we need that information pulled together on a regular basis.
With respect to the drug task force, so that was the previous task force that was mostly cross-ministerial folks that had, that Mr. Havervold had reported on, and I think Dr. Butt was on that, but a year and a half ago there weren't community members or other people, just is that correct? Am I correct?
Yeah.
So,
when I talked about it with the police, it was expanding the membership of the committee to include people from the community, people that potentially represent community-based organizations, Indigenous groups, and so we get a broader spectrum. And so that's kind of where we're headed, and with the draft terms of reference. And actually just, I think last week I sent out a letter to the police to re-engage them in that committee work as it got held up by the COVID, but yeah.
Does that, are you also including the RCMP on that?
Sure, attended that meeting.
So you have a set draft terms of reference at this point?
I haven't seen the draft yet, but my staff are working on it, and so I'll have something shortly.
So, and once you've got your terms of reference in the works, when are you expecting to pull this committee together to start doing the work?
We're asking for meeting dates in early August.
I just have to put on the record, I'm pleased to see that. I've expressed concern in the past that the committee wasn't broad enough, so I'm really glad to see that that is happening and can't happen soon enough as numbers continue to climb. So I'm really happy to hear that. So you're thinking early August for the first meetings?
Second meeting, kind of the first meeting where it would be a second meeting where we discuss the terms of reference, agree on the membership and that sort of thing. And probably for the second meeting to, in addition to the police, I would be inviting a few other people to see if we've got kind of the recipe right, for that committee. So
Mr. Hendricks, you'll be sort of pulling together those other parts of the committee with to ensure that you've got the right people invited?
I need to be clear, I'm not, one of the things that I said to the chiefs when I met with them is I'm not looking to create a committee of 1,000. I want it to be nimble enough that, we can move things along while wide enough kind of that we can get different perspectives. And so, I would guess an ideal kind of size would be in, the 10 to 12 range. I'm not thinking much bigger than that for the purposes. And over time too, it's kind of, evergreen. We can change it if it makes sense to do so.
And what kind of resources will be committed to this? Because you said you're going to elevate it to a higher level of committee. So what are we looking at in terms of resources?
Position in the ministry to support the secretariat functions of this committee.
Okay.
Just in terms of the emergency funding that was provided by the federal government, I know that it was sort of earmarked to fight against opioids, but also crystal meth. So I'm wondering if you can speak to how that funding has been employed as we're working to prevent opioid use in the province.
The federal emergency treatment funding for 2021 is $1.35 million. Of that, I said 2021. Of that, 85,000 is being allocated to the Saskatchewan Health Authority to build the capacity of health providers and allied health professionals. 90,000 will go to the SHA for resources and training for the treatment of patients using crystal meth specifically. 250,000 will go to recruit, train, and mentor healthcare providers to provide opioid substitution therapy, and 925,000 will go for an innovative treatment solutions fund to improve access and outcomes, which would be kind of on a RFP type of basis or a prospective type of basis. And so since 1920, like last year we had 1.425 million, and this year the amount is 1.35 million, and our what we speculate that we'll get next year is 1.325 million.
Is it a total of 5?
Yeah.
Oh, yeah, over a course
3
of
years.
Yeah.
In terms of talking about what's being done to prevent addiction, I'm wondering, the auditor talked about the prescription review program being meant to identify prescribers' prescribing practices by monitoring the 19 types of opioids, and said that because the ministry doesn't monitor all opioids prescribed in the province or actively monitor the program, it doesn't know whether the program helps reduce prescribed opioid misuse. I'm wondering if you can provide an update on where the ministry is at with that.
The prescription review program, as you probably know, in that program we partner with the Saskatchewan College of Pharmacy Professionals, the College of Physicians and Surgeons of Saskatchewan, College of Dental Surgeons of Saskatchewan, the SRNA, Saskatchewan Registered Nurses Association, and the Ministry of Health. And generally what that does is we use our systems in our drug plan to alert prescribers to things like multi-doctoring, as well as potential inappropriate prescribing or the use of medication to which the program does apply. So that would be opioids, benzodiazepines, that sort of thing, that are susceptible to abuse and misuse. And then physicians are directly alerted by the program, while other prescribers are contacted by their regulatory college. So generally what we try to use is an approach of education here, and we work with these physicians to educate them about their prescribing practices relative to their peers and what is appropriate in terms of prescribing. It's called academic detailing, and it's you know, kind of where we review what best practices are, and we do continue to obviously monitor that physician's use of or prescribing of those drugs. And occasionally if there's a person who doesn't respond to the education, that can escalate obviously into regulatory, kind of the regulatory space where the college would take action against a physician who is prescribing, or a dentist, I guess, or whoever. You know, and I guess in terms of the harm that comes from that, really hard to track, you know, because if it's licit drug use, normal, you know, that sort of thing, and a person becomes addicted, that sort of thing, it might have been a perfectly justified prescription. You know, people that sometimes become addicted to opioids through, I guess, regular, you know, usage of it. And then obviously, if it was illicit where they were, you know, there was over-prescribing and the drugs were distributed or diverted elsewhere, that would be a different issue. It's just really difficult to track the harm, so you've got to really hit it upstream with the physicians and other healthcare providers that are able to provide those. But all those drugs are tracked, and you know that you have to sign for them when you go to the pharmacy and everything. And so there's a fair amount of education that goes on with that.
Just in terms of those auditors' recommendations, did the ministry accept all of those recommendations in that report?
I believe my EA has that note, and I'll get that. So in terms of the auditor's report, in June 2019, the auditor did release a report evaluating the Ministry of Health's process to monitor the prescribing and dispensing of opioids in Saskatchewan. The auditor concluded that generally the Ministry of Health's processes were effective, but made 7 recommendations, of which we accepted all of them. So the Ministry of Health has already fulfilled 3 of the recommendations. A 4th recommendation is still being considered, and we're consulting with the College of Physicians and Surgeons on that one, and then there are 3 remaining recommendations, and we're kind of in the process of doing jurisdictional scans. To give you an example, there's a recommendation in there around risk-based approach to identify concerns in opioid dispensing in Saskatchewan communities. And to our knowledge, no other jurisdiction has been able or has done that. And you know, we just want to see what is out there and kind of what we're able to do to comply with our recommendation. But generally, we're making good progress on all of the auditor's recommendations.
Which of the 3 have been fulfilled so far?
Sure. So in terms of the auditor made a recommendation that the Ministry of Health participate in regular review of the list of opioid drugs associated with misuse and addictions. And to that, we've developed a prescription. We've talked about the prescription drug review committee, but we've also, or program, but we've also added a prescription review drug advisory committee. And one of the things that they've done in response again to this recommendation is that they've made additions to the list of monitored drugs, and those were made in February 2020, and this list will be reviewed annually so that it's always current, because new drugs are introduced in the market which can be abused. In terms of a recommendation, we recommend that the Ministry of Health work with the College of Physicians and Surgeons to consider requiring its members to review patient medication profiles. Policies to address electronic access to patient information have been approved in principle by the college, and we anticipate that we're going to be able to do a stakeholder consultation with them in the very near future, and that we'll have a future policy of requiring, mandating that there be a viewing of the PIP or the EHR prior to prescribing those drugs. And then we recommend that the Ministry of Health give those responsible for monitoring inappropriate opioid prescribing access and necessary patient information. We're giving access to PIP, our prescription information program, was provided in December 2019, and we're currently considering that as of right now by eHealth. And then, well, sorry, that one of those was in progress, sorry. And then the 4th one, the 3rd one, and actually completed, is we recommend that the Ministry of Health give those responsible for monitoring inappropriate opioid prescribing a functional IT system useful in identifying potential inappropriate prescribing practices and opioid misuse. And MicroStrategy, was implemented and in use as of May 2019.
Thank you for that.
So I have a couple follow-up questions on that, and that was a lot. So if you mentioned pieces of this, I apologize. The auditor also recommended that consideration be given to review patient history. And is that something you mentioned?
It's possible. So yeah, she recommended that we review patient medication profiles prior to prescribing. And that was the one where I said policies to address that. We're currently consulting with the College of Physicians and Surgeons, and there'll be, or working with them, and there'll be a consultation meeting in June 2020, and it will basically mandate the review of the personal information or pharmaceutical information program, so it will require providers to do that.
The role of pharmacists in the whole picture. In terms of, I did meet with a pharmacist before who mentioned the fact that there's no billing code for regular medication reviews on patients in terms of deprescribing and identifying any potential red flags. Is that something that's being looked at, and can you speak to, how a pharmacist would engage with identifying risks here?
And I checked into that one. I have a view, but I would rather consult. So there is a fee code for pharmacists to do a prescription review on a patient, so we do pay for that. I'm hoping that was your question. The other thing too is that because pharmacists have access to PIP, I'm not saying, or Pharmaceutical Information Program, I'm not saying that every time they'll access it. If you go in to get antibiotics or something, that wouldn't necessarily, in most cases, warrant a review, but if you were going in to get an opioid, I'm almost sure they would review your profile.
Thank you for that. Going back to the federal opioid emergency and crystal meth fund, the $250,000 to recruit and train health practitioners, so nurse practitioners and physicians. Just casting our mind back to a year ago where we lost 2 providers who had their licenses to prescribe opioid agonist therapy removed because of the College of Physicians and Surgeons and challenges there. So working in addictions medicine isn't necessarily everybody's cup of tea. So with the $250,000 that you're using to recruit and train, how is that going, and what is part of that $250,000? Sorry.
This is Russ, right?
So in 1920, $150,000 of the federal funding of that $150,000, 80,000 of that was annualized funding was provided to the College of Physicians and Surgeons of Saskatchewan. We also provided some additional money to them outside of the ETF to recruit, retain, and monitor physicians prescribing OST. During that period, we were able to, I have it somewhere, I just lost it. During that, in 2019, we were able to increase the number of OST providers through the College of Physicians and Surgeons of Saskatchewan by 22. And there were an additional 7 nurse practitioners that were authorized to prescribe as of May 20th, 2020. And the money's being used in a very similar fashion this year to expand it as well.
Okay. Oh, sorry. But I thought answered. They changed. Oh, wow. Okay. Sorry. In terms of the numbers then, and so where are we at in terms of people who provide opioid substitution therapy, both nurse, so you said 7 nurse practitioners in May 2020, but
nurse practitioners that are authorized.
And then how many physicians? So you said you increased by 22, but so how many physicians would be at this point in time?
I will have to check that. Just a moment, please.
Can you, if you can find the current number, but just some year-over-year comparisons? Okay, thank you.
So there are 102 physician prescribers of OST right now, up from 22 from last period. I did check about whether we can get a year over year, and we can. We just don't have it with us this evening.
If you could, why don't we go back? Well, we were using 2010 for those other things, so let's just make it simple and say 2010.
We'll do our best.
Okay, no, that would be great, and you maybe don't have those numbers. Generally speaking, if someone has done the training to be a prescriber for substitution therapy, are they generally doing that? Like, do you track that at all? So you have this many prescribers, but do we know if they're actually prescribing?
Yeah, we would know if they are prescribing it because it would be registered in our pharmaceutical. I think it would be varying degrees. You know, some people do this more intensively and have larger clientele that need that service, and some do it less frequently. But again, that would be something that we would have to go in and actually do a run to see how many are, are doing that on a frequent basis and what their client loads are.
Geographically, do we know where these, the physicians and the nurse practitioners are located?
Yeah, we could provide that, but we don't have that here.
That would be very helpful, actually, to get a picture of where the 102 doctors and 7 nurse practitioners are. Do you have?
Yeah. In terms of the lawsuit, is there we don't really want to put the cart before the horse, but is there a plan for, if we are successful, where that money will be targeted?
Your term, probably the cart before the horse, is probably fair to say the way we've been looking at it so far. And plus, you know, as we mentioned earlier, timelines, we just don't know. So obviously we could put it to good use, but there's no definitive plans yet.
Would there be a loose concept that, you know, it would go toward supporting folks who are actively fighting addiction or prevention or something that is within this stream?
I think it's fair to say that as the lawsuits advance, we'll start having some discussions about it.
Just going back to the federal money, just again thinking about, before we get to the final number of the lawsuit here, that 1.35 million federal dollars, my notes aren't entirely clear here. So it was 250,000 for recruiting and training the healthcare practitioners to prescribe. I think Mr. Hendricks said 925,000 for innovative treatment solutions, or a solution fund. Can you tell us a little bit about that?
A little bit. And unfortunately, I left that note up. No, I didn't. The 925,000 is for innovative treatment solutions for remote prescribing and wraparound care. And unfortunately, I handed the details off when I went up there, but I can get that.
Even in terms of all the details around the 1.35, did you hand off?
Yes.
Okay. Would it be possible, when you table everything else, to table just the 85,000, the 90, and we talked about the 250 and the 925?
Yes, we can do
Just
that.
explaining just a little bit more detail, understanding what that.
What the specific buckets are.
Yeah. Just chatting about the naloxone earlier, and we just talked about brief and social detox. And I know right now our program, and I think I've expressed this in committee before, where we have a few not-for-profit organizations who have the free kits, and we also have, I understand now we do it in the hospital. So it's been raised to me that we're not getting naloxone out the door to people who need it in quite the fashion that we should be, making sure that anybody who could be impacted has the opportunity to have one of the free kits. Is there any work being done on expanding the naloxone program? And just if you could clarify or confirm where people are getting the free kits at this point in time too.
We can clarify in a minute. If we've been making every effort to try to get that out as much as we can. Is there specific areas you're hearing from that are an issue?
Well, just outside of the Monday to Friday, like when an organization isn't open and you don't have $60 or whatever it is to go to the pharmacy. I know you can go to the pharmacy and pay for one, but having access to free kits has been raised as a concern.
Okay,
if you want it outside of a particular
Regular hours.
time. Yeah.
Should we go?
So we've recognized that in providing increased access to naloxone is an issue. So as part of our harm reduction funding this year, there's $500,000 to expand our outreach services and increase access to naloxone. So we haven't developed the specific strategies yet, but it could be working with some of our community-based partners to expand hours, that sort of thing, so that we can make it more available on weekends and later on weekdays.
You don't have you're just...
We're in the process of discussing that and implementing that.
Okay. And so currently, at this moment in time, can you just clarify where exactly, so where one can get the free naloxone kit at this point?
Well, right now they can get it from they can get it from CBOs, right? As you mentioned, they can get it from the pharmacy, but at a cost, right? And so what we're doing is looking at other avenues to provide naloxone so that's more easily accessible at no cost. And so we're just looking where to put that right now, but also the geographic distribution of it too. And so it's not just a big city kind of issue. And so we're looking at where we would have potentially other partners to provide naloxone as well.
And when you leave the hospital after an overdose, are you given naloxone? Is that correct?
I indicated that that would probably. I don't know for certain that it happens every time, but I would consider that to be good practice. If not, I assume that they would be referred to a community-based organization where they could get it, but I will confirm that and let you know.
Okay. Have you thought about, and I'm not sure if this has changed or not, but I know the Alberta model, I believe, I could be mistaken here, but I believe in Alberta you could go into a pharmacy and get your naloxone, and then that would be not billed to you, but billed to the province. Has that been considered, like making it accessible in pharmacies at no cost to individuals?
I think, anything that would improve access is on the table. I guess one of the challenges is that pharmacies, in some larger communities have extended hours and are open till midnight. Some are open 24 hours depending on the area of town. In smaller communities, that may not always be the case that you would have that availability. So I'm not ruling anything out. We would try and look at what meets the needs of that specific community most effectively in terms of expanding access, but that's a possibility. With whom are you working, or do you have a task force or a group of people who are working on this? I hate to use this as an excuse, but again, this is kind of work that has been delayed. And I think it's something that that we would work on in the ministry and consult with communities and our community-based organizations. We haven't set up necessarily a specific task force to do this.
Just conversations with current partners.
Yeah.
This is a strange question. I think I asked it in written questions too. And one thing that's been raised with me, not just death by overdose and not just surviving an overdose and using EMS services, but disability by overdose and ending up in long-term care. Do you have the current numbers where that, or maybe not even just long-term care, but actually that would probably be the best measure. Let's just say the number of people who've ended up in long-term care because of a overdose.
I will guarantee you that I don't have those numbers with me tonight. It wouldn't be just long-term care. It could be home care. It could be a variety where, their function has been diminished through some unfortunate incident. So I don't know that we have it. If we do, I'll endeavor to give you what information I can.
Okay. Thank you. I think you did have it for long-term care, but broadening that out, people who are now using...
Yeah, I don't have it with me.
Yeah, no, for sure. But just in terms of when you take a look at what you do have, looking beyond long-term care and what home care or whatever other supports, public supports people might have to access because of overdoses would be great. I think that I am good with my questions. Are you? Yeah, I think that that's all that we have at the moment. Thank you.
Thank you. Are there any more questions or comments from committee members? Seeing none, we'll proceed to vote on the clauses. Everyone ready? Clause 1, short title, is that agreed? Carried. Clause 2, is that agreed? Carried. Bear with my fingers here. I should have put tabs on the wall. Clause 3, is that agreed? Carried. Clause 4, is that agreed? Carried. Clause 5, is that agreed? Carried. Clause 6, is that agreed? Carried. Clause 7, is that agreed? Carried. Clause 8, is that agreed? Carried. Clause 9, is that agreed? Carried. Clause 10, is that agreed? Carried. Clause 11, is that agreed? Carried. Clause 12, is that agreed? Carried. Clause 13, is that agreed? Carried. Clause 14, is that agreed? Carried. Clause 15, coming into force, is that agreed? Carried. Schedule, is that agreed? Carried. Her Majesty, by and with the advice and consent of the Legislative Assembly of Saskatchewan, enacts as follows. The Opioid Damages and Healthcare Cost Recovery Act. I would ask a member to move the report, Bill number 199, Opioid Damages and Healthcare Act, Cost Recovery Act, without amendment. Mr. Cox moves. Is that agreed? Carried. Minister, do you have any closing comments?
Yes, thank you, Mr. Chair. First of all, I'd like to thank Jay for the questions and the discussion tonight. I'd like to thank all the officials that are here tonight as well for their time. To the committee members, thank you. And last but not least, Mr. Chair, to you, thank you for your time tonight.
Thank you. This concludes our business, or I guess, sorry, Ms. Chartier.
I just want to say again, and on behalf of Ms. Mowat and I, thank you to the officials here for coming tonight, including you, Mr. Hendricks, as always, and to the ministers and to committee members. And this is officially my last committee. It was a false alarm last week when I said it was my last health committee, but it's been a pleasure having the opportunity to ask those questions, and I'm not going to cry this time. I'm good. Thanks. Anyway, thank you, and thank you, Mr. Chair, and to your clerk.
This concludes our business for this evening. I would ask a member to move a motion of adjournment. Ms. Wilson has moved. All agreed? Carried. This committee stands adjourned until June 29th, 2020 at 3 p.m. Did I cut you off, Vicki?